Did you know that if you're suffering from long-standing pain, the first step out is being informed? In this 3-part series, I want to show you the 3 main types of pain we humans can experience. Knowing how to deal with it requires a lot of knowledge about what's happening to you and inside of you. And sometimes it can even lead to not being so much overwhelmed by all your experience because you can explain it. You know your way around. Here we start by talking about what is called nociceptive pain. Hi, I'm Gideon from PAIN.PAUSE.LIVE, licensed psychotherapist in Germany, specialized on the treatment of chronic pain patients, honored with the German Pain Award for Science and Pain Medicine in 2022, and a pain patient myself. In this channel, I want to inform you on a personal and scientific sound basis about chronic pain. Through nearly all of our body exists a fine web of fibers which are specialized for detecting any damage that might occur in our bodies. These fibers are called nociceptors. They report any damage done by pressure, heat, inflammation, and so on to the spinal cord, from where the signals are transferred to upper regions of the brain. Here, and only here, it is decided upon if you'll feel pain. Nociceptors are often described as pain fibers, but they're not. They are reporting changes in certain qualities of the tissue and actual damage. The pain signals comes from your brain, and only your brain. It's of help to imagine it like an alarm system people have in their houses. The nociceptors are more like the camera that is linked to the alarm. If anything suspicious or dangerous is going on, the camera reports it to the central alarm system, and this one sets off the alarm. Now, what's happening in chronic pain? As you might have experienced yourself, chronic pain tends to be more easily provoked over the course of time. Things you didn't care about back then suddenly start to hurt. That means the alarm system is going off more easily. If you compare it to the alarm system in the house, you can say that once it was set to detect burglars coming in, and now it already warns you when a butterfly flies by. And by the way, if you want to learn an effective and easy way to calm your nervous system down, you're very welcome to grab my free 5-minute meditation. Just follow the link in the description or at the top of the comments. Now, let's get back to the alarm system. Basically, this is what happens when you get more sensitive to pain stimuli over time. We call this peripheral and central sensitization. I already talked about central sensitization. You can see it in the video up here. In peripheral sensitization, the nociceptors become more and more sensitive because of activities of the immune system. Basically, you can say that they start to report damage when there actually is none, or only a minor one that wouldn't require any alarm system at all. Just to give you a quick example, nearly everybody knows aching muscles in the back, don't you? You know, the time when your physiotherapist lays his hands on your back and just says, "Oops, it feels hard as nails." Or the time you wake up in the morning and you don't know how to move because some of the muscles in your back feel stiff and are totally tensed up. Now, what happens there? For whatever reason, and there might be many, your muscles start to tense up. And if they keep this tension, they start to hurt. So much for the experience nearly everybody knows. Are you in for a little experiment with me? Let's explore one of the factors that lead to nociceptive pain. Just hold your hand flat like this and watch what happens to the color of your knuckles when you make a fist. They turn white, don't they? This is because the blood is pressed out of the small vessels in your skin. Nothing dangerous, just something that happens when there's not enough room for the normal blood flow and the rest of the tissue or parts of your body. Please see this example now as an analog to the tension in the muscle. It's not exactly the same. It's just an example to make it more clear what's happening there. When you tense up your muscle, the muscle fibers take up more room and the circulation and the really small vessels are partly restricted. Again, this is nothing dangerous that happens here because your muscles in their normal functioning tend to relax after a short while. If this doesn't happen, the body reports to the brain that something's not working out here. And a small, non-dangerous inflammation starts that gets your nociceptors working. If this signal is intense enough, your brain will decide to set off the alarm system. This is the reason why anti-inflammatory drugs might work well with this kind of pain. Additionally, warmth will have the effect for the muscle to relax and to increase the blood flow. And if you're one of those who like the cold, this will hold the inflammation at bay and it makes you less receptive for nociception. Additionally, the vessels first constrict a bit just to increase the blood flow in the tissue later on. So taking it all together, you can say that the fibers of the nociceptive system help to set off the alarm system, the pain in the brain. This is the most common source of acute and chronic pain. While chronification sets forth, the nociceptors evolve to a more sensitive version of themselves. But don't stop here to get informed. In this video here, I talk about what's going on in your brain when it starts setting off the alarm system. This is so important to know because when you understand this, it'll open doors to new interventions. And don't forget to subscribe to my channel.